Nigel Atherton, and I'm going to spend a few minutes talking about perineal trauma, perineal care and preventative measures. So the first point really is how common is perineal trauma? And it might surprise you to find out that NHS data actually show that there are around 270,000 women a year in England alone that are affected by perineal tears. And there are another 100,000 women a year that are affected by episiotomy. In fact, the NHS Maternity Services report cites that perineal tears are the most common delivery complications, affecting 40% of women, and episiotomy is currently running at 15% of women. So how severe is perineal trauma? Well, perineal trauma is categorised into four main grades of trauma. The first grade of trauma, first-degree tears, actually occur in around 1/3 of women that have perineal tears. And these are described in RCOG guidance and NICE guidance as superficial skin tears. But the most common tears are actually second-degree tears, and these tears actually involve the vaginal wall and the associated tissues and are far more serious. These tears happen in 2/3 of women that have perineal skin tears. The other two degrees of damage, third degree and fourth degree, are thankfully rarer, but even though they occur in a few percent of women, that's still tens of thousands of women in the UK that are affected by third and fourth degree tears. Third degree tears extend into the area of the anus and are categorised as 3A, B or C, depending on the involvement of the internal and external anal sphincter muscles. And fourth degree tears actually have trauma that involves the rectum as well. Interestingly, episiotomy actually causes the same level of damage in broad terms as a second degree tear. So what are the consequences in terms of the morbidity of perineal trauma? Well, there actually is quite a big list, and if you pick up some of the HCP information on the Elastolabo stand, it goes into far more detail around this. But just to pick up some of the key points, pain is quite an issue. Not surprising, if you just had a baby, you're going to have a lot of pain. But nearly 10% of women still have pain 3 months after childbirth. And in terms of pain during sex or dyspareunia, 15% of women will have dyspareunia up to 3 years after childbirth. That's quite an issue. There are other more significant issues almost in terms of bowel incontinence, which affects quite a large proportion of women that have had third or fourth degree tears. And there's an evolving story around what's called occult anal sphincter injury, which is third or fourth degree trauma, which is actually not identified at the time of childbirth and is picked up later. So what can be done? We have a common condition, we have severe comorbidities and issues with that. What can be done? Well, there are some preventative measures. The one that's been around the most is antenatal perineal massage. And in fact, there was a Cochrane review back in 2006, which looked at a cohort of primates, maybe around 2,500 women, meta-analysis of 4 studies, and that concluded that antenatal perineal massage in the third trimester of pregnancy led to around about a 9% reduction in the incidence of perineal tears that required suturing. That's a modest benefit, but a valuable benefit in terms of prevention of trauma to the woman herself and also in terms of cost savings. And in fact, it was that Cochrane review that led to the statement in the RCM's own Blue Book, which advocates the use of antenatal perineal massage in the third trimester of pregnancy. So if you do nothing else, then consider using sweet almond oil or olive oil or some other simple lubricant to do perineal massage. Over and above that, then there is something called the epinodilator, which people may have heard of. This is actually an inflatable balloon that you inflate in the vagina to actually dilate the perineum. It's backed up by a clinical study. You can make up your own mind in terms of the benefits of that in terms of reduction in episiotomies, but in terms of perineal tears, the incidence and severity of tears were not actually influenced in the publication by the Epino device. And the safety profile itself actually includes a reasonable proportion of women that had bleeding, pain, or even dislocation of the Epino balloon from the vagina in around 16% of women. However, having said that, I've met a number of midwives who have had ladies that have used Epino and had good results. And I think it just adds to the whole exercise of trying to educate people that there are preventative measures, there are some positive things you can do to reduce your risk of perineal trauma. The new product on the market is our own product, Elastolabo. This is a more conventional perineal massage product, but it actually has something in it called Elastocell, which is a skin elasticizer. And it softens the perineal tissues while you do the massage. You get a more beneficial massage. It's the only perineal massage product on the market that actually has clinical data to back it up. And it's a Class 2A medical device. So it has a quality package, it has a sensitization irritation package, and it also has a clinical study in 118 pregnant women. So in terms of the study itself, this was a GCP study. It was conducted only in primates, women having their first vaginal birth. They used Elastolabo once a day, 5 to 10 minutes from week 32 all the way through to delivery. And in terms of the soft endpoints, the slide you're looking at here shows the statistically significant increases in perineal elasticity or extensibility, which is stretch of the perineal tissues, as well as the elastic return of the tissues. You want to make them more supple and pliable, not just stretched. So those were highly statistically significant findings based on the gynecologist's assessment of the woman's perineum throughout the study. In terms of the harder endpoints, episiotomy rates, we saw large statistically and clinically significant improvements in episiotomy rates of between a 28 and 39% reduction. However, you have to take a little bit of care in discussing episiotomy rates because episiotomy rates vary with custom and practice. They vary from country to country, from centre to centre, hospital to hospital. In fact, a publication that came out in 1998 showed that in the UK at the time, when episiotomy rates were running around about the 40% level, that the variation in episiotomy rates ranged from somewhere between 26% and 67%. It really depended on where you were in terms of what your risk for episiotomy was. So probably a safer thing to talk about in terms of removing some of the variation is the perineal tear profile. Now, I mentioned earlier on that in women that have a perineal tear, 2/3 of them will have a second-degree tear. That's well established in a series of publications. And it was remarkable to note that using Elastolabo, 2/3 of the women that had a tear had a first-degree tear. 1/3 of the women had a second-degree tear, and we saw no third or fourth-degree tears. So that's quite a left shift in terms of reduction of risk of severity of tears. On the third and fourth degree tears, the study wasn't powered to investigate those. We might have expected to see a few third or fourth degree tears. We saw none. But the key finding really is about the reduction of the risk in terms of second degree tears, I think. And in terms of safety profile, really a very clean profile. Only 2 women reported either irritation or itch using the product. So quite a clean profile. So what is there in terms of formal recommendations? Well, NICE guidance and ARCOG guidance really deal with what to do when traumas occur, not how to prevent it, unfortunately. But the RCM's own guidance in their Blue Book actually cites data from the Cochrane Review. That Cochrane Review concluded that any method that was going to offer women a benefit of reducing perineal trauma was likely to benefit large numbers of women, as well as actually offering cost benefit advantages as well. And that was basically what went into the RCM guidance in terms of advocating antenatal perineal massage in the 3rd trimester of pregnancy. What about the cost benefit? Well, the cost of repairing a first degree tear or a second degree tear has been estimated at around about £690. The cost of Elastolabo on drug tariff, because Elastolabo is available on prescription, is £14.58 a tube. You would get through between 1 and 2 tubes in a pregnancy. 2 tubes if the woman is completely compliant, which of course you won't be. You won't remember to do it every day, or if you have vaginal infection or discomfort, then you won't use the massage that day. But you're looking at quite a modest price compared to actually the cost benefit. And of course these costs all track back now to the same budget holder within the new budget structure. So it's well worth thinking about preventative measures, not just from the point of view of reducing the risk of perineal trauma to the pregnant woman, but also in terms of the CCG budget level. Elastolabo availability. Well, I'm pleased to say that we actually managed to get Elastolabo on direct tariff last September. So it's now available on prescription, and women in England, pregnant women in England get free prescriptions. Of course, elsewhere they get free prescriptions already anyway. But, so it's available on prescription. If there's any issues with getting a GP to write a prescription for it, or a prescribing midwife to write a prescription, another alternative is through NHS supply chain. Elastolabo is actually available through NHS supply chain, so for instance through eDirect. You could actually use your own budget if you have that authority to order in Elastolabo and then free issue it to the woman if you wish to do that. And the details are there in terms of NHS supply chain. The product is, although it's available on prescription, because it's a Class 2A medical device, it's also available without prescription. So you can actually buy it online if you want. I'm pleased to say that actually, as from next week, it's also going to be available in super drug pharmacy stores as well. So just running through the key points, perineal trauma is actually a major issue, which I think deserves to be talked about a lot more, especially when 40% of women having a vaginal birth will have perineal tears and 15% have episiotomy. The pain and morbidities last for months and in some cases years. But it's been shown that antenatal perineal massage does have some benefits. It's advocated by the Royal College of Midwives, and the Elastolabo has got an additional component in it to give more benefit. It's the only product on the market for antenatal perineal massage which is clinically validated, and it's now available on prescription.